Team TB or Not TB from Brazil, India, South Africa, and Turkey welcomes you to our innovation set in India. I'm going to be telling you the story of Sanjay. Sanjay is a 34-year-old man living on a weekly wage in the Turbhe district in Navi Mumbai. Sanjay is the breadwinner of his family and is responsible for the care of his wife and 3 kids. In November of 2019, he was diagnosed with tuberculosis. He was referred to the government-funded TB DOTS program implemented by the primary healthcare center in his area. This is where he goes to receive his free fortnightly medication. He also submits his used medication strips, which acts as a treatment adherence check as per the revised National Tuberculosis Control Program. Despite being unable to go to work, he was optimistic that at the end of 6 months, he would be free of the disease. That was until March 2020, when India, like many other countries around the world, went into a strict national lockdown due to COVID-19. He called the community health worker to inform her about his dwindling medication supply that would end 5 days later, only to be informed that their stocks were running low and the pharmacy was closed indefinitely. Come August of 2020, a new community healthcare worker was facilitating the distribution of the newly stocked medication noted that he had missed his TB medication for 4 months with a loss to follow up and was subsequently marked as a treatment defaulter who was now also resistant to the first-line anti-tuberculosis drugs. And even worse, his wife and 3 kids have now tested sputum positive for tuberculosis. Do you think that Sanjay's story was an isolated one? TB modeling done by the World Health Organization expects a conservative 13% increase in tuberculosis deaths that can be attributed to the impact of COVID-19. This will bring us to TB mortality levels experienced 5 years ago. The biggest victim of COVID-19 is undoubtedly the health system of each nation. It is now evident that the ambitious strategy to end TB in India by 2025 has been dealt a severe blow.
What happened with Sanjay, as shown in this descriptive problem objective tree, is primarily due to restricted access to free medication, diversion of human resources to COVID-19, no medication accountability checks, and the worsening socioeconomic status precipitated by the current pandemic. Turbhe, our pilot suburb, is one such district since the population has a high MDR TB and HIV burden with an existing infrastructure that enables the implementation of our intervention. We also have close contact with the stakeholders in the region, like the primary healthcare center, district hospital, and its community workers. With the assistance of the FOG behavior model, we have ensured the convergence of patient motivation, ability, and ease of innovation, and regular prompts for maximal impact in our patients' behavioral change. We propose a one-stop WhatsApp or text message hotline manned by health workers to answer treatment queries and take medication orders that can then be home delivered by health workers who anyway go door to door delivering immunizations. The patient will not miss a single day of medication and will also not be forced to come to the dispensary. Adherence is best achieved by using a familiar app like WhatsApp, keeping in mind the health inequities that may arise as a result of limited access to WhatsApp. We also propose an alternative simple SMS line that can then be used to cater to a wider variety of patients, taking into account their socioeconomic status. Push notification reminders can be sent by health workers to take medication at the same time daily. Adherence motivation while isolating can be maintained by creating WhatsApp buddy groups that are supervised by a health worker. Photographic proof of empty medication strips will serve as an adherence check. Patient-led group calls to provide support, share adverse drug reactions and treatment results will allow patients themselves to feel in control of their treatment journey. Since travel is no longer necessary, funds allotted to travel allowances can be used to improve the nutrition status of patients. The existing drug inventory management app, Nikshay Aushadhi, can be used by healthcare workers to easily source drugs from the public and private sector during the lockdown. The second lockdown can now be an opportunity to pilot the intervention, aiming to study outcomes before scaling this project nationally.
Our intervention aims to strengthen community healthcare workers and local stakeholders by providing local real-time information and access to healthcare whilst lessening the economic and social burden of tuberculosis in the COVID-19 pandemic. Even after the pandemic ends, the suggested treatment access and adherence strategy can be continued as it is economically and logistically convenient in a resource-constrained setting. A SWOT analysis helped us better understand where each stakeholder stands in terms of our innovation. We were then able to figure out how we can divert weaknesses into strengths and threats into opportunities to collaborate further. We also conducted a stakeholder analysis. Our biggest stakeholders are the community healthcare worker, the patient, and their families. Their cooperation and willingness to accept the intervention is key to its success. We rely on peer support and constant medical vigilance to keep patients' motivation high, as well as ensuring adherence. The already promised close cooperation with the RNTCP clinic located in Turbay that supplies the anti-TB medication helps to ensure an uninterrupted supply and delivery of medication to its own local community. Engaging local NGOs can spread out the word for our intervention. The private sector, like pharmacies, will make certain that the community is self-sustainable, reaches inaccessible populations, and ensures that nobody is left behind. The scaling of this project requires keen involvement and financial power of the Ministry of Health and Family Welfare in India. They need to maintain the drug access and provision systems to ensure all health centers have enough stocks of medication during the second lockdown. Using the existing Nikshayokshadi app, a needs assessment can be done to prioritize which centers needs to be replenished first. The contribution of telecommunication companies will be significant if we can divert their initiatives to provide free phones and internet towards the patients and the community health workers for a national level. Let me also remind you that our intervention focuses on the resource constrained settings, thus it will not require extensive financial investments. However, it is important to realign national goals and divert funds to maintain the continuation of existing disease control programs. Small improvements implemented today can translate into the cost reduction of thousands of dollars into the future. Our expected outcomes for the innovation include a 90% patient adherence, 10 trained community healthcare workers, and having every patient in a buddy group or in direct contact with a community healthcare worker. Our indicators to measure the success are the accessibility of the intervention in both the TB patients and healthcare workers, adherence statistics, TB spread ratio, and its impact on public health.
Let's imagine Sanjay's life in the second lockdown of COVID-19 in India after the implementation of our innovation. TB medication stockpiles have now normalized. Being aware of Sanjay's interrupted medication regimen, the health worker reestablishes contact with him to continue his and his family's treatment for the newly detected MDR-TB. Sanjay informs the community health worker that he and his family are hesitant to travel and get their medication, and he has since lost his job and cannot afford private healthcare. The healthcare workers have organized a community-based system of delivery after learning from the pitfalls of the first lockdown. Since Sanjay and his family have only one mobile phone, Sanjay sends a message to the hotline and orders his entire family's medication. The health worker checks the photographs of the empty medication strips before delivering him the next fortnight's supply, knowing that adherence is being met. The additional nutritional allowance allowed him to surpass the financial low tide due to his unemployment. Sanjay and his family and wife occasionally join the peer support group calls to networking via the WhatsApp group and has also found employment. Fast forward to 12 months later, Sanjay and his family have successfully adhered to the complete treatment regimen and are hopefully TB-free. Moreover, the community has seen benefits as well. The TB transmission lowered and people are healthy to contribute to the betterment of society. Due to extremity guidelines and a high adherence rate, the community health workers can feel accomplished and motivated to continue their tireless efforts within the national TB program. Telecom companies, due to their COVID efforts, managed to get corporate social responsibility tax benefits and an improvement in their perception of their company in society. The Ministry of Health, whose goal it was to mitigate the setbacks caused due to the first lockdown, can still be on track to achieve its End TB 2025 goal.
At last, we would like to finish by remembering that this is not only for Sanjay, but also the millions all around the world that suffer from tuberculosis and were unintentionally forgotten during the current pandemic. We might not be able to change the past in which COVID-19 had exacerbated all system weaknesses and consequently allowed us to neglect diseases with worse outcomes, but we can endeavor to build together a resilient and sustainable healthcare delivery system for the future. Thank you.